Across India, a quiet campaign is underway. In schools, teachers speak about addiction. In villages, volunteers hold meetings. In district offices, officials track rehabilitation numbers. Posters carry a simple promise: Nasha Mukt Bharat, a drug free India. The scale is extraordinary. More than 15 crore people have been sensitized against substance abuse. Over 5 crore young Indians have been reached through awareness programs. Across districts, de addiction and rehabilitation centers operate every day. Nearly 28 lakh individuals have undergone treatment. Addiction, the state tells us, is not merely a crime, it's a social wound that must be healed. But a few hundred kilometers away, in a carefully demarcated fields of Madhya Pradesh, Rajasthan, and Uttar Pradesh, another story unfolds. At dawn, farmers walk slowly between rows of poppy plants. They bend carefully. They make a precise incision. White latex appears on the surface of a bulb. This is opium, one of the most tightly regulated crops in the world, cultivated legally under license, measured, monitored, and audited plant by plant. In 2025, Government of India expanded this cultivation. More than 1.21 lakh farmers are now eligible for licenses, a 23.5% increase in single year. 15,000 new farmers were brought into the system. The justification is medical necessity. Opium is a raw material for morphine and other essential medicines. Medicines that relieve unbearable pain in cancer wards, trauma units, and palliative care centers across the world. Without opium, patients suffer. With unregulated opium, societies suffer. This is where the ethical tension becomes impossible to ignore. On one hand, the state runs one of the world's largest anti drug campaigns. On the other, it legally cultivates and expands one of the most closely controlled narcotic crops on earth. One policy tells citizens drugs destroy lives. Other policy tells farmers grow this drug carefully, legally, for medicine. Is this a contradiction, or is this what ethical governance looks like when choices are tragic, trade offs are unavoidable, and every option carries harm? And this episode is about how public policy carries moral choices, often hidden beneath rules, numbers, and good intentions. We examine why the state cultivates opium legally, why it treats addiction as a public health responsibility, and what happens when two commitments collide. When the same state produces a narcotic and fights addiction, how should moral responsibility be understood? Who bears the cost of this tension? The patient, the farmer, the person struggling with addiction, or the administrator who must decide? To understand the ethical tension in this episode, we first need to understand the policy itself, without assumptions and without emotion. India is one of the few countries in the world legally permitted to cultivate opium. This permission does not come from domestic choice alone. It exists under international drug control agreements that allow cultivation for medical use. Opium is a raw material for essential pain relief medicines, morphine, codeine, and related drugs used in trauma care, cancer treatment, and palliative medicine. From a public health perspective, legal opium cultivation is not a luxury, it's a necessity. India's opium policy for 2025-2026 is designed to meet this medical demand while limiting diversion into illegal markets. Legal cultivation is restricted to three states: Madhya Pradesh, Rajasthan, and Uttar Pradesh. Under the current policy, over 1 lakh farmers are eligible for licenses. This represents a significant expansion from previous years. Most of these farmers are small and marginal cultivators. For them, licensed opium cultivation is not an abstract policy, it's a livelihood. The system is tightly regulated. Licenses are issued annually, yields are measured, production is monitored field by field. Farmers who meet required standards are allowed to continue. Those who fall short risk losing their license. The policy logic is clear: allow cultivation, control it strictly, and reduce risk wherever possible. The state also controls processing and manufacture. Common facilities convert raw opium into medical alkaloids under international quality standards. In policy terms, this represents as responsible governance, meeting medical need, maintaining control, and supporting rural livelihoods under strict supervision. On its own, the policy appears coherent. It addresses pain relief, it limits diversion, and it operates within global rules. But public policy does not exist in isolation, because while one arm of the state regulates and expands opium cultivation, another arm is engaged in a very different mission: to reduce addiction, to prevent harm, to make society drug free. To understand the tension fully, we need to turn to Nasha Mukt Bharat Abhiyan. To understand the other side of the story, we need to shift focus away from cultivation policy towards social harm. Substance abuse does not affect only the individual who consumes, it affects spread outward. Families are disrupted, education is interrupted, livelihoods are weakened, health systems are strained. These harms do not occur randomly, they follow patterns. They repeat across communities and over time they accumulate. It is in response to this reality that Nasha Mukt Bharat Abhiyan was launched. At its core, the campaign treats addiction not simply as a law and order issue, but as a public health concern. The approach is deliberately broad. First is prevention, reaching people early, building awareness before harm becomes entrenched. Second is treatment and rehabilitation, recognizing that recovery requires medical support, counseling, and sustained care. And third is the community involvement. Because addiction is not addressed effectively by enforcement alone, families matter, local institutions matter, social environment matters. Because addiction is not only a private struggle, addiction harms are patterned, predictable, and widely shared. When harm appears at this scale and with this regularity, it's no longer incidental, it becomes a public concern. Public ethics holds that when harm is systemic and foreseeable, the state has a responsibility to intervene, not to assign blame, but to reduce avoidable suffering that is produced and carried collectively. And this is where a quiet tension begins to surface. Because while on one arm of the state works to reduce the harm caused by narcotics, another arm regulates and expands their cultivation for medical use. Both actions are aimed at reducing suffering, but they do so in different ways. To understand that tension fully, we now need to examine what happens when these two goods collide. At this point, we're looking at two public responsibilities that do not sit easily together. The opium policy exists to ensure access to essential medicines and to support livelihoods under strict regulation. The Nasha Mukt Bharat Abhiyan exists to reduce addiction, protect vulnerable populations, and prevent long term social harm. Both pursue legitimate public goods, and yet they pull in different moral directions. This is not a clash between right and wrong, it's a conflict between two things that are both right. From a utilitarian perspective, the question is simple and deeply uncomfortable. Does this policy reduce overall suffering? Legal opium cultivation enables morphine and other pain relief medicines that ease severe suffering in hospitals and palliative care. At the same time, diversion and misuse contribute to addiction, crime, and social harm. Utilitarian reasoning does not deny either side. It asks us to weigh suffering against suffering, the pain of the patient against the pain of the community. This explains the trade off, but it does not resolve the tension. The Kantian perspective approaches the dilemma differently. Here, the focus is not outcomes but principles. Even important public goals do not justify every means. No policy, however necessary, permits treating people merely as instruments. The concern is not that the state cultivates opium. The concern arises when farmers are reduced to production units or when people struggling with addiction are managed only as risks rather than as humans. For Kant, a policy is morally acceptable only insofar as it respects individuals as persons in themselves, never merely as tools of governance. Even taken together, these perspectives do not dissolve the conflict. To understand why, we turn to Isaiah Berlin. Berlin argued that human values are plural: liberty, security, health, dignity, and welfare. All are genuine moral goods, but they're not always compatible. Some choices are tragic but unavoidable. In such cases, the task of governance is not to eliminate contradiction, but to choose knowingly and to remain conscious of the moral costs involved. From this view, the coexistence of opium cultivation and anti addiction mission is not a policy error, it's an expression of value pluralism in governance. Two legitimate commitments, pain relief and harm prevention, coexist, even though they cannot be fully reconciled. Ethics here is not about finding a clean solution, it's about recognizing which values are advanced, which are constrained, and who bears the cost. And this is where philosophy leaves theory and enters administration. Ethical conflicts do not remain in policy documents. They arrive as files, as inspection reports, as yield statements, as signatures that must be placed by a certain deadline. This is where the paradox we have examined becomes a lived experience. Consider the position of a district level officer in an opium growing region. On one side, the officer is responsible for enforcing a tightly regulated narcotics policy. Yields must be verified, licenses must meet minimum qualifying thresholds, deviations raise red flags, not only administrative but also criminal. On the other side, the same administration oversees awareness campaigns, de addiction efforts, and rehabilitation under Nasha Mukt Bharat Abhiyan. Two responsibilities, one institutional actor. Both duties are legitimate, neither can be ignored. Michael Lipsky famously argued that public policy is ultimately shaped not only by laws but by the discretionary choices of frontline officials. No policy, however detailed, can anticipate every real world condition. Rainfall fails, soil quality varies, data is imperfect, human behavior is unpredictable, and yet decisions must still be made. Imagine a farmer whose yield falls just below the qualifying threshold. The shortfall is real, the rule is clear, but so is the context: erratic weather, rising cost, and no evidence of diversion. The officer knows the consequence. License suspension may push the farmer into distress. Leniency, on the other hand, risks weakening regulatory integrity in a sensitive narcotics regime. This is not corruption, this is ethical pressure. The stakes are higher because narcotics regulation does not operate in morally neutral space. Under NDPS framework, errors are not easily reversible. Suspicion can carry stigma. Enforcement can escalate quickly. Discretion is exercised under the shadow of severe law. The administrator must therefore ask, am I enforcing a rule or am I unintentionally inflicting harm on someone with limited control over circumstances? It would be easy to frame this as a matter of individual judgment, but that would miss the ethical point. The dilemma arises not because officers lack integrity, but because institutions assign them competing moral duties. The state asks its administrators to be both guardians of regulation and agents of compassion. It is precisely because both roles are valid that the tension persists. Isaiah Berlin's insight returns here not as a theory, but as a lived reality. When values are plural and incompatible, someone must still choose, and the choice is often made quietly, without applause, and with moral residue. To fully understand the ethical cost of this paradox, we need to move beyond institutions and return to people, to the farmer whose livelihood hangs on a metric, and to the individual whose life is shaped by addiction. This is where policy becomes personal. Until now, we have spoken about policies, frameworks, and institutions. But ethical contradictions do not remain abstract. They surface in ordinary lives, quietly, unevenly, and without ceremony. To understand the cost of this paradox, consider three people whose lives are shaped by the same substance in very different ways. In an opium growing district, a farmer prepares his field for inspection. His crop is legal, licensed, closely monitored. His livelihood depends on meeting a yield threshold set hundreds of kilometers away. Rainfall has been uncertain, costs have risen, the margin for error is narrow. A shortfall does not mean wrongdoing, but can still mean suspension. For the farmer, opium is not a drug, it's a survival measured, regulated, and conditional. In a nearby town, another life is unfolding differently. Addiction has narrowed choice. Work is irregular. Relationships are strained. Trust is fragile. Under the Nasha Mukt Bharat Abhiyan, this individual is no longer seen only as an offender. There is counseling, treatment, rehabilitation, but stigma remains. Recovery is uncertain, relapse is always possible. For this person, the same substance represents loss of control, of dignity, of the time that cannot be recovered. And somewhere else, far removed from both fields and counseling centers, a patient waits in pain. Cancer, severe trauma, chronic illness, morphine offers relief when little else can. For this patient, opium is neither livelihood nor vice, it's mercy. These three lives rarely meet, yet they are connected by a single policy space. The farmer grows a regulated crop to sustain his household. The patient depends on that crop to live with dignity, and the individual struggling with addiction bears the social cost when regulation fails or diversion occurs. None of these lives is morally trivial. None can be dismissed without ethical loss. This is why the paradox cannot be resolved by declaring one policy right and the other wrong. To prioritize pain relief without considering addiction is ethically incomplete. To pursue a drug free society without acknowledging medical necessity is equally incomplete. Ethics here is not about choosing a side, it's about recognizing that every policy choice distributes vulnerability differently. The question then is not whether this contradiction exists, it clearly does. The real question is how should state respond when its moral responsibilities pull in opposite directions? That is a reflection we now turn to. By now, the paradox at the heart of this episode is clear. The state cultivates opium to relieve suffering through essential medicines. The same state fights addiction to prevent suffering within society. These are not careless choices. They are responses to different moral responsibilities that cannot be perfectly aligned. Ethical governance, then, is not about eliminating contradiction, it's about acknowledging it openly. First, it reminds us that public policy is not a moral equation with single correct answer. Policies operate in a world of uncertainty, scarcity, and human vulnerability. When values conflict, pain relief versus harm prevention, livelihood versus regulation, governance becomes a matter of judgment, not certainty. Second, ethics is about how we carry trade offs. The ethical question is not whether trade offs exist, they always do. The question is how they are carried. Are the moral costs recognized or quietly shifted onto the most vulnerable? Are policies adjusted when harms become visible? Are administrators given space to exercise judgment with humanity? Ethics in public life demands attentiveness, not moral perfection. Third, why paradox does not mean hypocrisy. It's tempting to label such contradictions as hypocrisy, but that would miss something essential. Hypocrisy is pretending a conflict does not exist. Ethical governance begins when conflict is acknowledged and managed honestly. The coexistence of opium policy and the Nasha Mukt Bharat Abhiyan does not signal moral failure, it signals the difficulty of governing in a world where legitimate values collide. This is why ethics cannot be separated from policy, not because policies are immoral, but because they are morally demanding. Every policy distributes risk, opportunity, and vulnerability. and every such distribution carries ethical weight. In Policy Spotlight, this is what we seek to examine, not what policies promise, but what they ask of society in return. A nation that grows opium to ease the world's pain must also confront the pain within its own communities. Ethics begins not when contradictions are resolved, but when we take responsibility for living with them thoughtfully. That is not weakness, that's a moral burden of governance. So long, happy learning.